Our role mainly is to promote health. We're public health nurses, so it's to promote health of the family. And we have child health clinics, which we do twice a week, where families come with their concerns, we discuss them, we monitor the development of the child. If the mother is depressed, it's going to impact on the child. So we support mothers, fathers, grandparents, everybody around the child.
They ask you questions, simple questions, baby rash, nappy rash. You tell them how to manage those things and they go home and it works for them and they come back, oh, it actually worked, thank you very much. You know, you can't express it. You feel very happy that you've been able to help them.
And you know, when you're collecting the data, okay, these children have been immunized, is this number left? And you actually know that you're actually one of the people who is driving those families to come and get immunized.
My job at the moment entails working in 6 primary schools and 1 secondary school in Tower Hamlets. Preconceptions people have about me being a school nurse is that I'm a knit nurse, and I'm not a knit nurse at all. My job in school is to go in to work with families and children who have a medical need in school and to ensure that they maximise their full potential and that the staff that are there working with them know how to handle their medical condition in school. We also work with children that are subject to child protection plans or are vulnerable, when it might be because their parents have a mental health problem or a substance misuse problem, and we're there to support the child and the school and the parents. I came into community because I really like the whole public health agenda, and I went into school nursing because I like working with children and families. They're the most honest people that you can ever get to work with, and you can have such a laugh with them. It's about, you know, getting them to fulfil their potential in life.
We run a rehabilitation service for children between the ages of 0 and 16 who have sustained an acquired brain injury. We have a multidisciplinary team, so it's headed up by the nursing and care staff. We have a physiotherapist, speech and language therapist, occupational therapists, educational psychologist and a clinical psychiatrist. And we all work together to improve the abilities of the children following an acquired brain injury.
We try and base ourselves on being a big home and a big house, really. So we've got the lounge area and we've got separate bedrooms for each child, and it's just so not like being in a hospital. I love seeing the progress that the children make. I love them, you know, the fact that this is rehab and this is generally where children get better. So it's really great when they start regaining skills and doing things like starting to walk again.
You've got to have good communication. I think that's critical because you're working with families and children who've sustained a significant injury. Whether it is from a car accident or it's from having a brain tumour, these are significant things that will basically change that family's life forever. And being a team player, you have to be part of the team to work in a organisation and a setup like this.
I've been here 11 years and I really, you know, wouldn't still be doing the job if I didn't like it. So yeah, it's a very rewarding job.
You can have a really challenging child, and to actually sit and work with them, put plans in place and to give them their independence back. And then you get like the big smiley thank yous and the, you know, it's just, that is the rewarding part of the job. I love it. It's brilliant.